Hello, I'm Lucy and I am a wound care pharmacist and the community pharmacy and a home medicine review pharmacist. So today I'll be talking about the truth and myths of wound care. Okay, so as a wound care pharmacist working in the community pharmacy, I often see a lot of people coming in asking for advice for wound care. And I hear a lot of misconceptions about wound care that often comes from outdated information. And my role is to educate every person that comes through in the community on the latest evidence-based wound care practice in order to improve their chance of healing. So today we'll be going through some of these common misconceptions, and I will update people on the concept of moist wound healing, the choice of antiseptics and dressing, and we'll go through some examples of acute and hard to heal wounds. Okay. So one of the most common questions I get when people coming into the pharmacy is, can I have some betadine or Dettol to help, dress my wound and leave it on? And my advice is that most acute wounds can actually be cleaned with saline in clinic and gauze. And in the home environment, if potable tap water can be used initially to clean the wound and on every dressing change. And the evidence is that we should not actually be using toxic antiseptics like peroxides, iodine solutions, alcohol or soap to clean or treat the wound. And the reason for that is that these harsh chemicals can actually kill off the nice healthy cells on our wound that are essential for healing. So if you do use an antiseptic agent like betadine or Dettol, they really should be washed off after about 3 to 4 minutes. And that's to clean really dirty or contaminated wounds like soil, glass wounds. And that just needs to be cleaned off thoroughly so it doesn't actually do more harm than good. So wound care has come a long way, and since our grandparents used to dab wounds with cuts with mercurochrome and other fancy chemicals. So really just keep it simple. Use tap water at home or saline as a sterile way to clean your wound. So one of the concepts is that essential to wound healing is that concept of moist wound healing. And this is something that has been studied many, many years ago. So Dr. George Winter, back in the 1960s, he did experiments with covering a wound with a vapor-permeable dressing and one that was left open to dry out. And he found that there was one that was covered healed a lot quicker than the ones that were left open to dry out and form a scab. And after that, there's many studies to show that moist wound healing actually heals 2 to 3 times faster than wounds that are dried out. And that's the essential concept we need to really spread to the community to help improve the rate of healing and prevent unnecessary infections and delayed healing. So optimum moist wound healing, moisture, and that balance of moisture, not too dry and not too wet, is ideal environment for wounds. And as an example, I have a patient who left their wound to dry out and it formed a scab. And a lot of people think, great, that's going to heal nicely. But actually what's happening is that it's just forming a cap over the wound. So once we moisten that area and the scab comes off, what you might see is that it's not actually healed underneath. It's just stored the wound from actually progressing. So you won't actually heal until that scab comes off and its wound is covered with a proper dressing to help close from the edges. So we just need to remember that, moist wound healing, not drying out wound, is essential. So another question I get again is, should I leave my wound open to dry out? And from what we just seen, Drying out wounds and forming a scab can generally delay healing. So covering the wound with the appropriate dressing will create and maintain an environment that's suitable for healing. And you can find this in the Wounds Australia website. There's actually a patient information leaflet called What Should I Do to Take Care of My Wound? And this is a great resource for people in the community as well as healthcare professionals who can provide to their patients on these tips to help prevent from a wound from becoming delayed. Okay, so there are wounds that may become delayed because of lots of different reasons. And one of them is that accumulation of bacteria. And all wounds are contaminated. There is bacteria in the environment, in the skin, and they're not always harmful unless they build up to a certain level. And if you start to see these signs of infection, these are the clinical signs that help diagnose an infection on a wound. And that these are pain, increasing pain, swelling around the wound. So if you also have redness or feeling hot and warmth around the wound or feverish, and if there is increasing discharge or pus on the wound bed, that might be a bit yellow or green. And if this wound's getting a bit smelly and malodorous, then these may be signs that your wound is becoming infected and getting to a level that may require the use of antimicrobials topically as well as orally. So do see a health professional very promptly if you see any of these signs. And biofilms are a term that's used for a buildup of bacteria that really get very sticky and colonized, and they form a cluster. It's very hard to break through, even with topical antimicrobials and antiseptics and antibiotics. And they can contribute to delayed healing. So we really need to be able to manage the slough and the biofilm on the wound, often by thoroughly cleaning and regularly debriding the wound. And we can show you some tips to help do that while the wound is dressed. Okay, so that's another picture that shows, a biofilm that may be quite slimy in appearance and quite stuck to the wound bed. Okay, so next. Okay, so these are some examples of topical antibacterial products that may be used to help clean and debride the wound. And one of them is inflammable hydro, which is an enzyme gel. So it contains two components: hydrogel, which helps to donate some moisture and help provide that debridement, so it can help remove and loosen some of that slough and pus and clean it off. It's got an enzyme complex that helps to kill and slow down the bacterial and fungal growth. So it helps to control that level of bacteria. And it's also got L-genate, which helps to mop up or absorb any exudate in the wound. So quite useful for common wounds like cuts, grazes, skin tears, burns, and other types of wounds as well. Quite soothing because of that hydrogel component as well. Manuka honey is another one that we use quite commonly, and it is known as MediHoney, and it's a medical grade Manuka honey that has antibacterial and anti-inflammatory properties, and it has been shown to be quite effective at debridement and providing that moist wound bed and helping control those bacterial levels on the wound bed. So also quite useful for a lot of acute wounds as well as chronic wounds. And these products needs to be used on a regular basis along with that rigorous cleaning and covering with the wound as secondary dressing. This is an example of a wound that has been covered with slough and bacteria, and after a few applications of the flammable hydro, managed to help reduce that slough and have that nice pink healthy wound bed. Another example with Manuka honey and a burn that has become infected, and she was referred to the doctor just had antibiotics, and then we continue cleaning and using topical antimicrobials to help control that biofilm and reduce the bacterial load to get that nice red granulation tissue. And the choice and application of dressings are very critical and necessary for the recovery of the wound. So dressings are ideally absorbent, not traumatic, and maintain a moisture balance. So a lot of people do use plasters, and especially for that minor wound or wounds that are cut and they don't have much else at home, they may use that initially. But they're not ideal dressings because they don't absorb any blood or exudate. So very, very light pad on there that has very limited ability to absorb anything. So you can get that macerated look after you take it off. So that it's white around the wound bed, and so it's really going to cause a wound bed that is too moist or too wet. And again, we want that balance. So having an interactive dressing that helps to absorb and protect the wound bed as well as mop up any excess moisture, that will help to prevent from a delayed wound healing and risk of infection often. So a silicone foam dressing in this case was used, and that helped to close the wound bed very nicely. And so an appropriate dressing is one that helps to create an ideal wound healing environment that's warm and moist. So silicone foam dressings are one of the type of dressings that are interactive, and the one that we just saw on the finger. So it's made of layers of foam that helps to wick up and mop up the fluid in the wound bed and just really bring it up into the foam so it's not staying on the wound bed and causing excess moisture. It minimizes pain and trauma on removal because the silicone on the foam and the border is very, very gentle. So it's very unlikely to tear the skin or cause any damage or pain when you remove it. There's very low risk of allergy or sensitivity to the adhesive. Most people are not sensitive to that adhesive, and so less risk of irritation on the skin. It maintains a moisture balance and absorbs the exudate. So as we said, that helps to keep the wound bed in the ideal environment. And it is water resistant. Most of them can have some water resistance, but we'll often tell people to try and keep the dressing dry if possible in the shower, and try not to bathe or swim in it because it can still get wet and then it needs to be changed. So to keep it on for longer, try and keep it dry if possible. Cling wrap it, or keep your arm or leg out of the shower if possible. This can be tricky, but that does help a lot. So that's an example of a silicone foam dressing on a skin tear, and we will go into that later. So a skin tear. If you have a sustained skin tear, and the skin flap sometimes can be lost or it can be intact. So you want to clean the wound and the flap with saline and gauze as much as possible, and cover the wound with a silicone foam dressing, which is the first line treatment for skin tears as part of the updated guidelines. And that usually will keep the skin tear quite protected as well as the surrounding skin. But important also to moisturize the area around the wound outside of the dressing, because it does help to minimize that dryness, irritations, and there has been study done by Professor Carolyn Carville in WA that shows that moisturizing twice a day with a good moisturizer can actually prevent the risk of skin tears by up to 50%. So that's pretty significant if you want to prevent yourself from having skin tears in the future. Tubular bandage has also shown to be protective on the skin and also had some compression. So that also helps to improve the healing rate, according to the latest evidence. And then you also want to review and change it, because it is really important that when you put on the dressing, you do check and remove that after a few days, and that could be every 3 days or every 4 days, depending on how much fluid and blood is coming out of it. And you want to be able to clean it and clean off any dead tissue or dried blood or discharge off the wound bed before replacing it with another dressing. So you want to monitor that until the wound is definitely closed up, and this is how we helped manage this skin tear with that silicone foam, with that tubular bandage, and then checking every 3 days and seeing how that wound is going. And you can see that the skin tear or flap has closed and restored on the skin, but it is still very quite fragile, so we need to protect that with that moisturizing and the tubular bandage. So again, the updated guidelines for skin tear management. For silicone foam dressing is first line for skin tears. I do see a lot of people coming in that have their skin tears taped up with steri strips and many layers or strips, and another one came in with gauze that has been stuck on the skin tear. And these people are very distressed because they don't know what to do about their wound, and it's causing them pain and trauma. So we want to minimize that as much as possible. And the guidelines suggest that we really need to avoid anything that can be quite sticky on particularly fragile and thin skin. Things like gauze and tapes and adhesives and closure strips and plasters, they're not recommended for skin tears, and particularly on fragile skin, and because it can cause more damage and do more harm. So please try to deter people from using those type of adhesives if they ask for it, and update everyone on the best guidelines or best practice for skin tears. Another common type of wound we get is people coming with a cut and from a knife, for example, in the kitchen, and it's bleeding. So the first thing to do is to help stop the bleeding. You can use an absorbent pad at home, and we have in the pharmacy a calcium alginate dressings that helps to clot up the bleeding, help to slow it down. So it's basically a seaweed type of fiber dressing that helps to clot the blood and stop the bleeding. So it's hemostatic, but it does need a secondary dressing like a crepe or a cohesive bandage that helps to keep it secure and provides that pressure on the wound and helps to reduce the blood flow to the area. And elevating the limb, hand, leg also helps to slow the blood flow. So just getting them elevated on a table. And you can wait a few minutes, 5 to 10 minutes, and see if it has stopped bleeding. Sometimes it will soak through. There's quite a bit of blood, and you may need to repeat that dressing process until the blood flows slows down, or blood bleeding stops. If the bleeding doesn't stop, say after 15 minutes or half an hour, you do want the patient, or if it's yourself, to go straight to the doctor or medical clinic to have that addressed. There may be may need investigation in terms of any nerve damage, tendon damage, or a deep wound that requires further attention. If it does stop bleeding, then we usually will remove all that and then dress it with the proper dressing. So ideally, you don't want to leave that on the wound for over a few hours or longer, because it can sometimes get stuck on the wound bed and can be quite difficult to remove. Island dressings are very common dressings that you'll find, and these are great for protecting a wound that is quite low in exudate or quite dry. So if there's a little bit of fluid or a little bit of blood, they're great for protecting it. So it's got this melanin or island pad that has a thin layer, and it has a bit of absorptions. So it is vapor permeable, so it's breathable, so it allows gas to pass through, but it doesn't allow any bacteria to get through. So generally for superficial cuts, grazes, post-op wounds, and maybe other types of wounds that have low exudate, the adhesive can be sometimes quite sticky to remove. So we have to be quite careful when removing it, and that you know the technique to remove film dressing. And sometimes people can be allergic or irritating. The adhesive can be quite irritating to their skin. So if you find a rash around the border of the adhesive or under it, and it's quite itchy, then there's a chance that you could be quite sensitive to the adhesive. So ideally using a different type of adhesive like silicone may resolve that. On thin and fragile skin, it can be quite tricky to remove, and you don't want to tear the skin. That can happen. And we can use things like remove wipes to help break up the adhesive bonds and help to gently remove it and prevent any tears. Okay, adhesive closure strips are commonly used for cuts and to help close the wound edges. And this is appropriate for wounds that have straight, clean cut edges and low risk of infection. So they are generally not deep or dirty, and within 24 hours, ideally. So example of that, a small laceration that's not deep and it's quite clean, and within 24 hours, the stereo strips or adhesive closure strip help to close the edges, and that's primary closure. But they're not appropriate for wounds that are open, so they may have not granulation tissue and they might have a build-up of bacteria or slough on it, and that strip is just not going to do any good on there. So that needs to be cleaned and covered with a vapor permeable dressing. This is a quick guide for burns. If anyone sustains a burn of any type, you need to make sure they do the first aid, and that is essential and critical to preventing a wound from becoming deeper and from preventing from further development of that burn. So running under cool tap water or under a shower tap for 20 minutes at least can help to prevent that. And this is effective for up to 2 to 3 hours after a burn. So make sure you do that before anything else. So these are some criteria for referral, and Fiona Stanley Burns Unit has a very good service for people. If anyone has these type of burns, like electrical burns or circumferential burns, large areas, straight to the burns clinic or your closest one. And they also have consultations available for remote rural areas as well as metro. Post-op wounds are also very common because people do get a lot of skin cancers these days. So you will often get a guideline of how to look after your wound. This is a guideline from North Metro Health Service. It's a patient information leaflet, and it does state to avoid skin cleansers like alcohol, peroxides, iodine, or soaps with antibacterial chemicals because they can cause damage to the wound tissue and slow the healing. So just be mindful if you do use things like betadine or other types of antiseptics on your wound. It's best to clean with saline and cover it with a island dressing to help protect that wound, or a silicone foam one, especially if there's any fluid or discharge coming out of it. This is an example of a post-op shave wound that was left open, and there you can see there's a build-up of slough and biofilm on the wound, so that's not going to heal until that comes off. And we used topical antimicrobials to do that, and using a dressing as well, checking regularly until that slough comes off. Stitches that has been left open, and this person goes bathing and it was very active, so it became red and inflamed and quite sore, so she was felt some discomfort there. So we told her to check with their specialist with this wound, as well as providing them an island dressing that is breathable and protective. And after a couple of days of covering with the dressing, she felt a lot better just from covering it. and you can see that it's less inflamed and it's less sore. Okay, this is an example of a lower leg wound that was after a post-op wound incision. So it's quite open and there's some depth to it as well. So, and you can see there's slough on it. So it was covered with a silicone foam dressing, and she was referred to our pharmacy for compression stockings. So she had lower leg issues like venous edema as well as varicose veins, and these are common signs of that venous condition. So this wound we cleaned and used a slow release iodine, so iodazole, which is not toxic to the healthy cells, and change and review every 2 or 3 days until that slough has come out, and you can see that wound bed has come up from underneath and the edges were starting to close up. And 3 weeks later, we finally got the wound to close up, but we also made sure that she had been fitted with the right fit of compression stockings, and that provided enough pressure to help improve that circulation, improve the fluid and the blood to go back to the rest of the body. So it's not staying there and causing a delayed wound, which is often a cause of chronic wounds and venous ulcers. Some of the other signs of lower leg condition and the vein condition are if you get achy legs or achy cramps and swelling in your lower legs. And sometimes people get varicose veins or spider veins. And a lot of people do get eczema, itchy, dry, flaky skin. That's also a common sign. Swelling and fluid build-up in the ankles and the feet, particularly towards the end of the day. And so those symptoms need to be addressed very promptly. So please do see a health professional about it and not leave it untreated, because it can lead to chronic wounds like leg ulcers that don't heal very well until it's managed. And our pharmacy does have a Legs Matter flyer that helps to educate our patients in the community on the symptoms to watch out for and how they can be addressed. So they need an assessment to see if it is a venous condition that's causing these symptoms, and they may be fitted with a compression therapy that helps to manage the swelling, aching, itching, and all those symptoms associated with it. So there needs to be the right fit and the right pressure, and to rule out any arterial issues that could be in a contraindication for compression therapy. In terms of lifestyle things, we always tell people to try and do walking, which helps to activate that muscle pump and get the venous return going, but also not sitting or standing for long periods of time, because that gravity will cause that fluid to build up in the lower legs and cause these symptoms. So compression stockings help to provide that graduated pressure to help that venous return and prevent the symptoms from deteriorating, and helps to prevent that chronic condition from progressing. And just finally, in terms of skincare, everyone is using alcohol-based products and hand sanitizers for hand hygiene, which is great. And particularly with COVID, we're all very aware of that. But alcohol-based products can be very drying and can strip the good bugs. So we need to be aware that we want to protect our skin from drying out and becoming irritated and getting skin conditions like eczema and dermatitis, which can flare up. So when we use these products, make sure we moisturize daily and regularly with a good moisturizer to protect our skin, and after washing our hands. And if you do wash your hands, make sure you use a soap-free wash rather than soap, that can also cause drying out and affect the pH or acidity of the skin and strip the skin of moisture. One case I had in the community that I'd really like to bring some awareness to is that some people come out of the hospital with a wound, or they may have a wound that needs to be managed, and they don't know where to go. So one of my patients came from the hospital and she sustained a type 2 skin tear on the right leg. So you can see that there's a necrotic flap on the area that is dead and been there for a long time. And she's been out since 4 weeks ago at least, so she didn't know what to do, where to go. She found us through the pharmacy and as a wound clinic, and we provided a treatment plan and some advice on how we can manage this wound. And she came in very distressed and upset because she's been living with this for over a month and she couldn't see any way that it could heal. So her quality of life was very poor. So we started with the topical treatment with antimicrobials, and there was different types of antimicrobials used at different stages to help provide that debridement and cleaning, and quite rigorously. And we used that dressing plan with silicone foam and monitored that her signs of infection. She had seen the doctor as well and had started on antibiotics. So we provided this treatment for over 2 to 3 weeks, and the wound size really reduced. You can see that the necrotic flap had been removed, and we tried to remove that slough as much as we could, and that became that nice red granulation tissue. And the size of the wound was contracting from the edges, and you can see that nice epithelial edge. And that was quite a significant improvement. And she was really quite happy with the progress, and she felt a lot more relaxed about it, and she could see that the wound was improving. So her quality of life and her pain levels and trauma levels reduced significantly as well. By 9 weeks, the wound had finally closed, and we also provided compression therapy to make sure that the fluid in her legs were managed as well. And she was very pleased with the outcome, and she was very, very grateful for our service and time. And the most important thing was that she knew that we were there to help her, and just having a health professional that she could trust and be able to rely on to have her wound healed was the most important thing for her. So just that final message, if you have anyone in the family, or if you know anyone who come out of hospital and don't know where to go, or from a surgery and they don't know what to do with their wounds afterwards, make sure they get to the right person, and make sure you have that wound managed and not leave it untreated before it becomes worse and becomes a delayed wound. So we want to be able to prevent from chronic wounds by just addressing the wound as soon as possible when it is sustained. And that will help to improve healing rate, reduce infection rate, as well as increased hospitalization as well. These are some references, and that will help hopefully provide some more awareness in terms of managing acute and chronic wounds in the community. Thank you.